Now, good afternoon, everyone. Welcome back again for exciting topic. Our first session for the afternoon is disaster services system, preparedness and recovery for elderly. This is very important topic as we address the challenges faced by elderly during natural disaster. Please join me in welcoming Dr. Narumon Sawan Panya Lerth, Senior Advisor, Department of Medical Services, our moderator. Thank you.
Swadika. Good afternoon, everyone. Welcome to the Preparedness Disaster Services System. I would like to, this session we have 1 hour and a half, and we have the professor, 2 guests that it will be sharing with us. I would like to invite Dr. Tatsuro Kai, Professor Kai. Please join us. Understand. He is the advisor from the Osaka Saisei Senri Hospital from Japan. Dr. Professor Kai, please. And another one, Dr. Richard Brown. He is the Program Manager Health Emergencies and Antimicrobial Resistance WHO from Thailand. Please, Professor Kai. Please. Okay, please sit down, please. Thank you. So today that we will discuss on the disaster service system, preparedness and recovery for the elderly. So mostly that, as we know that now we face with the many disasters in the world, right? So for the important thing that we will learn more on the global situation and also the global concept that we're working on that by Dr. Rick. And also we follow by the Professor Kai that focus on the Japan, how Japan share experience and for me, for the Thailand experience. So Dr. Rick, please.
Okay, so yeah. So firstly, thank you for inviting me to say something on behalf of WHO on this really important topic. So I'm going to be providing a WHO perspective. So perhaps this slide is going to be very clear to many of you, but what it is showing is a percentage of the total population who are over 60 years old in different countries in the Southeast Asia region for WHO. But also, this is based on available data for past years, but also a projection up until 2050. So again, it's the percentage of the population over 60. And you may not be able to see, but the red line is for Thailand. So this is a phenomenon that's happening in all countries, but at least where this region is concerned, the projections for what we expect for Thailand are that, if you like, the greatest percentage of any of the countries in the region, certainly by 2050, we expect to see in Thailand. So I think they're saying, based on this projection, by 2050, then 38% of the population of Thailand will be over 60 by the 2050. And again, I wasn't sure if the focus of this was on disaster or aging, but if you are experts on aging, I think you know this. But you know, an important question is, sure, you can live longer, but does that mean you live longer in good health? And that's not always the case. And what the graphic on the right-hand side is showing, that we know that, you know, you can live well past the age of 60 in good health, but then there comes a time when you start to experience poor health. And then you can look at the distance between these figures, if you like, and you can see what it's, sorry, I realize I have a pointer. What it's saying is that on average, if you look at all the countries, you expect to have each person about 5.4 years of poor health at the end of your life. But actually, sorry, let me go back. And again, this is showing the same data, but in a table. And you can see that for Thailand, by the time you reach the age of 60, based on the situation at the moment, you can expect to live another 23.6 years. But actually, your healthy life expectancy at 60 is 18 years. Although the previous slide sort of paints this in a negative way, I actually think this is really encouraging. You know, to think that by the age of 60, you can expect to live for another 18 years in good health. But I think what I also find interesting is this difference, or this average amount of time that you spend in poor health is actually almost the same for all countries. So the longer you live, you know, you will have more and more years of good health before you start to experience poor health. And that's really important in the context of this discussion, because what it means is that people are active and they can make an important contribution. So coming to the WHO kind of guidance on this, in fact, I realized when I started looking that there is not so much. So these are two guidelines that were, I think, published in 2008. I mean, there is an update coming later. But what I tried to do was to look at these two guidelines and summarize into a series of presentations what they say and what they recommend. So firstly, when we look at addressing older persons in emergencies, there are some case studies that show some key findings. So as you might expect, the challenges are that there is deterioration in health and increase in vulnerability, and this is partly due to lack of access to healthcare, limitations in mobility and sensory impairment. Also, particularly in some countries, older people experience social isolation, partly because of the breakdown of traditional family support structures, and they may experience psychological stress. Also, economic hardship, loss of livelihood, and lack of access to resources. We also know that in emergencies, women are affected disproportionately, and there are some risks of abuse and exploitation, although that's generally for younger women. But some of the key lessons learned are, as we would expect, preparedness is crucial to minimizing the impact. Also, community involvement improves resilience, but that older people are often overlooked when it comes to emergency planning. Then these guidelines suggest there can be an active aging framework for emergency management. And this framework would have three pillars. One is about health, ensuring access to healthcare and support. The second is participation, which is engaging older people in community efforts to strengthen preparedness and response. And the third, maybe there's something around providing safe housing resources and support. And again, as we might expect, the things that we expect to be determinants or important in considering this framework are people's physical health, their social status, their economic status, the strength of health systems, their personal behaviors, gender, and the culture in which they live. So coming to some policy recommendations, again, this is back in 2008. So for the preparedness phase, it's important to identify the at-risk older populations and raise awareness of their needs. It's important to develop age-sensitive medical and emergency plans, to strengthen community-based support and this should include consultation with older people. Also, targeted communication and dissemination of information. And also something about training emergency responders specifically to cater to older persons' needs. And then in the response phase, two things it picks up on are to ensure age-friendly evacuation centres, I guess particularly in places where there are disasters and typhoons, but also to provide continued access to medical care and social services. And in my experience working mostly on public health outbreaks and the experience during COVID, this is really about continuity of essential services. It's making sure that people are still going to be able to get their blood pressure medication and so on. And then in the recovery phase, it's important to consider reintegration into the community, which I've heard has been quite a problem in Japan, to strengthen health systems to meet the aging population demands, and also to address the longer-term health and social needs. But also coming to what older people can bring to this discussion, it's recognized, and the case studies show, that older people do play a significant role in resilience and community rebuilding. And examples from these case studies are older people provide care and guidance to younger generations, they offer leadership and traditional knowledge, and they kind of provide surge capacity. They can support recovery through volunteer work and social cohesion. Retired doctors and nurses can provide healthcare surge capacity. But maybe kind of stepping back a bit for what's happened since 2015 in the broader kind of arena for aging. In 2015, WHO launched a world report on aging and healthy aging. And this, as it says, aims to develop and maintain the functional ability that enables well-being in older age. And there are these dimensions that, where you see this tree, it might be difficult to read, but it's maintaining mobility, supporting learning and growing and decision-making, meeting basic needs, building and maintaining relationships, and looking at their contribution. And they talk about functional ability. And functional ability is a combination of an individual's intrinsic capacity, but also the environment in which they live and operate. So you need to build people's individual capacity, but it needs to be done in the best possible enabling environment. And then also, more recently, there was a UN decade of healthy aging, again, not focusing on emergencies, but it had 4 action areas, 4 enablers, and it tried to put older people at the center. And I'm just flagging the 4 action areas. So first is to encourage all of society to change how we think, feel, and act towards age and aging. We should ensure that communities foster the abilities of older people, and we need to have some focus on delivering person-centered, integrated care and primary health services that are responsive to older people. And also, we do need to provide access to long-term care for older people who need it. And then, I did not know this until a few days ago, but the WHO CIRO, the Southeast Asian Regional Office, have been developing a regional strategy on healthy aging. And this guidance is almost final, but it's not yet final. So you're getting a sneak preview. I think it's going to be finalized and published quite soon. And again, this is not focusing on emergencies, but as you'll see, it covers it. So in the middle, this is what this document will look like. And then on the left, I've put a picture of our regional director and a quote. So she says, older people have irreplaceable experience and wisdom. When enabled and supported, they make meaningful and substantial contributions to families, communities, societies, and economies. And then, placing it in context for us today, it also flags the ongoing challenges posed by infectious diseases, including COVID, and also, as we all know, flagging that natural disasters, including earthquakes, cyclones, and floods, disproportionately impact the health and social well-being of older people. And then, this is a busy slide, I understand. This was happening before, I don't know why. Okay, and I'm not going to go through it all, but as often we see in strategies, there are, on the left, some guiding principles that, when we approach all the areas of focus, you need to do it in a holistic way. You have to address issues of equity, promote innovation, any measures need to be sustainable. And it also does see WHO as an enabler. And there's a goal and a purpose of the strategy which are articulated, but also 4 strategic priority areas. And you'll see the way it's structured. I will show some slides that look at what is recommended for health emergencies for each of these 4 strategic priorities. And then it has these 7 actions, but as I've circled or put a square around in red, one of them is humanitarian crises. And then it also identifies a number of enablers, and these are covered in the next slide, so I'm not going to focus on it now. But I don't know why it does this. It's just automatically advancing. So the 4 strategic priorities are, again, echoing what we heard already. Changing how we think, feel, and act towards age and aging. And I think this is important when we come to disasters. Ensuring that communities foster the abilities of older people, also important. Thirdly, it's delivering person-centered integrated care and primary health services responsive to older people, very important during a disaster. And then the last one is about providing access to long-term care, which of course is important, but again, I think this is like just about maintaining your regular services despite responding to a disaster. It's going to continue doing this, I can see. So these are the 7 action areas. So they're different domains that are considered important. So law, policy and governance, community, financing, service delivery, workforce. Then we see a kind of slightly bigger articulation that says protecting older people's rights in humanitarian crises. And then the last one is about data, information and valuation. And then it also identifies a number of enablers. And I think for these, the first one, co-creation, speaks to the need to involve older people at all stages of this process, to seek their wisdom, their input, and to allow them to share their perspective when you develop all these, strategies, national strategies and guidelines. And the second one is about community empowerment, which we know for large-scale disasters is critically important. And maybe I won't focus on the others. So what does this mean in practice? What does this document say? So firstly, when we consider changing how we think, feel and act towards age and aging, what this means in our context is about policies and procedures. So we need to ensure policies and procedures are in place that protect the human rights of older people during crises such as national disasters. And then the second one, ensuring that communities foster the abilities of old people. 3 components. The first one is very similar, developing and implementing national policies that provide resources, infrastructure and processes to support older people during humanitarian emergencies, including evacuation plans and targeted relief efforts. Then the second is technical guidance. So the strategy, when it's implemented, will include technical guidance to WHO member states about policies and procedures to ensure safety and well-being of older people. And then the third component is advocacy. So again, this I think is largely for WHO and concerned authorities to advocate for the protection of older people through age-friendly environments during emergencies. Then the third strategic priority of this WHO document is delivering person-centered integrated care and primary healthcare services that are responsive to older people. So firstly, standards and procedures to ensure older people have access to essential medicines, vaccines, and health products and services during crises. And then technical guidance, so to provide countries, again, I think this is, for WHO, to provide technical guidance with specific consideration for care of older people. And then lastly, about providing access to long-term care. Again, I've said I think this is really just carrying on maintaining business as usual There's nothing really that you need to do extra during an emergency, but you need to ensure that whatever arrangements you have in place continue to operate during an emergency. And that actually, this is my last slide. I mean, I realize although there's not a lot of WHO guidelines, there's a lot that are produced by the UN. They don't necessarily focus on health, but they do focus on what's important when we're considering older people during a response. And I'm hoping we'll be able to share this presentation, but just to explain, you need to click on this image and it opens a Word document in which all of these links are active and will take you to the actual guidance. And then lastly, I got AI to generate this graphic, which I think is trying to show that I didn't have a summary slide, but I think the really important message is to recognize that older people are not just victims in a disaster. They're a really, really important resource who should be involved in planning, in response and recovery. So thanks for your time.
Thank you so much, Dr. Rick. So from Dr. Rick talking about in the global that we can see that mostly of WHO try to set up for the preparedness, and also the other thing that he talking about how the health deterioration, social isolation, and also the community. So not only the health personnel, but also the community and also the system that will help the preparedness for the elderly people to working. And I like the last slide, the before last slide that he talking about that we could read more in the document that the WHO prepared for us, and also in the last slide that have many situation for the disaster, right? Now, after we learn on about the WHO that mostly are focused on the global and also the ASEAN, no, not ASEAN, zero, sorry, about the zero that talking about the concept. Now we will go to the Japan. Professor Kai will share us about the Japan. Please, Professor Kai.
Good afternoon, everybody. And Dr. Narman, thank you very much for inviting me to this wonderful conference. Yes, today I'd like to present the disaster service system and the preparedness and recovery for elderly in Japan. And first, this slide changes in the elderly population and the percentage from 1950 to the 2023. That Thailand and Japan situation is a little bit different. And then first you understand Japanese situation. And rate of the elderly, Japan is 29%. Now Thailand is 14%. That's very different. And the near future, 10 years later, Japan increased to 34%. But in Thailand, 21%. That means super aged community will soon coming in Thailand. Okay? Next, please. Oh, sorry. Oh, myself. Okay. This is the characteristics of elderly lifestyle in Japan. That's completely different in Thailand and Japan. And the rate and the population of elderly living alone in over 65 years, 50%. 10 million people living in alone. And that single people live in the more than urban area than rural area. That means in the rural area, maybe community know who one is single or not. But in the Bangkok, so many population, do you know? Neighboring the one family or etc. In Japan, this situation. And the rate of elderly living with their spouse only, couple living 30%. In the daily time, this old couple taking care of together. But sometimes one take care with a disability person and etc. At the time of disaster, what shall we do? And next, the rate of the elderly living in the nursing care facility. In Japan, over 5% living in the nursing care facility. The Thailand, just 0.3%. At the time of disaster, elderly nursing care facility also affected as a damage. And health workers are working in this nursing care facility become victims, and they can work in this family. And suddenly increased elderly person needs care. How to do? What to do? There's a number of nursing care facility for elderly, 22,000. But Thailand is 1,000, completely different. This is the situation in Japan and Thailand. And then next. This is the number of deaths and missing person by type of disaster. This also a little bit different. In Japan, that the pink color, that means the earthquake and tsunami. That 91% deaths were occurred by earthquake and tsunami. And only 44% by storm and flood disaster. In Thailand, main cause of a natural disaster is the flood. Maybe? And so also, flood is different. In Japan, is 70% of land in the mountain area. And then, after the heavy rain, soon water coming. And then, that means the flood means the flash flood. There's a short time to become overflow of the river. Yeah. But in the Mekong River and the Chao Phraya, the increase is very slowly, and then overflows the dike. That's completely different. This is a comparison ratio of age group and cause of death at 13 years ago that earthquake occurred in Japan. That this rate, that upper column is the total number. Mainly, these earthquakes occur early mornings. Many people sleeping in the house, and then almost 80% or more than 80% cause of this is a suffocation crash to death. But please look at burn to death and visceral injury and traumatic shock. It's old age people. It's very difficult to evacuate. Yeah, the early people were difficult to evacuation from the fire and the broken house and etc. And next, the comparison of the population rate and the death rate at the East Japan earthquake disaster. This left side, that population rate. I already mentioned the aged population is almost 30%. But the right side, this is the two Iwate Prefecture and the Miyagi Prefecture. And the second column, we show the last arrow. But the death rate is over the 50% of aged population. And Miyagi also over the 50%. That means very vulnerable for the aged group. This is also another disaster. 2018, the Western Japan heavy rain disaster. Now, left side, that's the rain cloud radar from July 5th to July 8th. That 4 days, this area had a heavy rain, continued 4 days. And right map, this is a hazard map for a flood of this Kurashiki city. This purple yellow area, that means if the broken over dike, that case, that become a flood. That the purple area means some area over the 5 meters. And then the real situation, left and the upper map show dike collapse of Onoda River, and then like a real picture is the flood. And the left side here, that's a blue area. That is a true flood area. These are almost same as the hazard maps. That means everybody know if this dike collapsed, this area become a flood. But this is an event at 6th to 7th July at Kurashiki City. The 6th day, morning 11:30, evacuation alert level 3 was issued. That means elder people who with disability and others who may need more time to evacuate should evacuate from an affected area. And that night, 22 p.m., evacuation alert 4 was issued. That means all residents should evacuate from the affected area. And 22:40, evacuation alert level 5 was issued. That means life-threatening situation. Ensure safety immediately. And then 7th day, midnight, overflow at the dike of the river occur. And then morning, dike collapsed. And then become a very flood. You know why I show you this is? That's the time to evacuate. First evacuation 11:30, and dike collapsed the next day. And then this is the casualty at the city of Okayama Prefecture and Upper Kurashiki City. I show the hazard map. That area, 52 people were killed by flood. Then 9 people were get a severe injury. Yeah. They have a lot of time for evacuation, but many people die. This is this by age group. That's a Kurashiki City, right side. Over 65 years, 29%. Over 75, the 58%. Total is nearly 90%. And this place is almost 86% in the house. That means aged people was not able to evacuate, even if they have a time. It's very important issue. Most important, the risk communication. Of course, Japan has a good weather broadcasting and warning system, but old age cannot get this information. That's very important. And this is the number of consultation cases for 6 days of the same disaster. That one, number one, the skin disease, wounded, stress. This is July, and then the heat stroke and the ARI. This may be also same in the Thailand. Yeah. And age group is almost same. But before leaving the shelter, how to evacuation, that's very important. Vulnerability of a disaster in the elderly one, difficult to evacuation activity at the disaster. Lack of physical stress, difficulty in obtaining the disaster information. Aged people is weaker of information and need the support of evacuation. Okay? And then the 2013, the Basic Act on Disaster Management was amended in Japan. Municipality have to create a list of a person requires assistance during the evacuation, such as elderly and individual with disability, who have difficulty evacuation on their own during the disaster. And then local government conduct evacuation drill and disaster countermeasures meeting at the community level, and then check the hazard map, the evacuation route, and the evacuation split over shelter, and etc. When a disaster will happen, evacuees have to call out to their neighbors and evacuation together. Please move this video. Maybe this, how to, yes. This is a tsunami simulation of Nankai Trough. This tsunami will occur. Possibility of a tsunami is 70 or 80% within 30 years. That's one of the biggest worst scenario in Japan. The coastline. First, we feel the ground motion, and then 5 or 10 minutes later, tsunami hit the coast area, some area. Okay. And then, local government made an evacuation tower, like a left picture, and local government designated the strong concrete building as a tsunami evacuation building. And so now we have built a lot of this kind of bridge near the coast. And another, the lesson learned from eastern and northern region in Japan, this region has a lot of experience with tsunami disaster. And then tsunami tendenko, that's Japanese. This area has a lot of sad story and tragedy. At the time of a tsunami disaster, younger people, family try to save and evacuate their family or old people, and then hit the tsunami. All people was killed by tsunami. And then now, if a tsunami comes, don't worry about taking anything, even about your family. Each person should run to higher ground on their own as quickly as possible. Protect your own life yourself. I think that's very important. Protect your own life yourself. That's a very important message for you. And vulnerability of disaster in elderly too. Difficulty of the elderly for disaster circumstance. Difficult to adapt the life of evacuation center, temporary house, and affected area. The collapse of the local community, bad environment in the shelter to live. And there is nothing to do in the shelter to compare with before the disaster. Many elder people have had a medical history, difficult to access the medical facility, lack of physical strength, and etc. This is a very impressive data. At the time of northern Japan tsunami disaster, some Dr. Okawa Yayoi have this research. Rate of elderly people who are able to work before the disaster but could not do 7 months after the disaster. Yeah, the elderly who did not need care for daily living, that kind of elderly, he live in the temporary house, 30% after the 7 months, they could not walk. And the house of their own house, 21%, moved to the out of the time, 28%. And some elderly who need the care for daily living, but was able to walk by themselves. That kind of people, almost half could not walk after 7 months. That's very important data, because if disaster hit the aged population near half of elderly people could not work. And next, I try to explain the disaster related to this. This is not a scientific academic word terminology. This is the political terminology. That the definition refers to the death caused by the worsening of injury due to the disaster or illness resulting from the physical strain during evacuation of a similar situation, which are officially recognized as disaster-related deaths under the Act of Provision of Disaster Condolence Grant. That means if the people die by national disaster, local government gives the disaster condolence payment here, and the 5 million yen, and some families are 2.5 million yen, and that. And then we have a lot of this kind of data. And then this is the disaster-related deaths among the disaster. And Hanshin-Awaji earthquakes, 40% of the related disaster-related deaths. And the East Japan earthquakes, Kumamoto earthquakes, that's very important. There are so many disaster-related deaths. 87% is over 70 years old. And the Kumamoto earthquakes, 78 over 70 years old. That means even if the elderly don't die by direct disaster death, many of them die by disaster-related cause. And this is the timing of the disaster-related death in Kumamoto earthquake. Most disaster-related deaths occur within the first 3 months before people move into the temporary house. That means shelter conditions is very bad in Japan now, even now, okay? And this is the cause of disaster-related deaths. The first is the physical and the mental strain caused by shock of the earthquake and the fear of earthquake, aftershock. That's 40%. The physical or mental strain experienced in the evacuation, shelter, and similar situation, 28%. And the delays in the initial treatment due to the suspension of the medical facility function, including the hospital transfer, including the worsening of a pre-existing condition, and onset of the new illness. To the upper three causes is 85%. Yeah. Yeah. Oh. Next, the breakdown of disaster-related deaths. First is respiratory disease, pneumonia, bronchitis. That's almost 30%. And the circulatory disease, that's heart failure, subarachnoid hemorrhage, deep vein thrombosis, that means almost 30%. And the intrinsic sudden death, that's 13%. Suicide, 8%. Old age elderly people lost their hope to live, and then select some the suicide, etc. That upper is almost 60%. This is the medical issue faced by elderly individuals in the evacuation shelter during disaster in Japan. Exacerbation of chronic illness. Yeah. The elderly individual often suffer from a chronic condition such as diabetes, hypertension, heart disease. Stress and environmental changes in the evacuation shelter can worsen their condition. The lack of access to the prescribed medication, irregular lifestyle in shelter, and etc., and the risk of infection, and dehydration and malnutrition that sometimes distribute meals may not suit for their dietary needs. Very hard meal, and sometimes very high sodium food, and etc. That's bad condition. And the dementia and the psychological stress. Elderly individuals with dementia may struggle to adapt to the unfamiliar environment of evacuation shelter, lead to confusion and highlighted anxiety and the sudden environment changes or separate from a family member, lack of adequate support, and etc. And the mobility and the daily living changes, lack of barrier-free facility, insufficient number of caregivers, and the shortage of medical staff and supply, and blah blah. Very, very bad condition, that means. And then solution and preventive measure. Prepare individual should carry medical record and a medication notebook. Stockpile essential medical supply at the shelter in advance. And the improvement of a shelter facility. Install the barrier-free infrastructure. Create a medical space for and blah blah. And deploy of a special staff. And the infection control. That's the same every year. And then, EMT, emergency medical team, is very crucial, very important at the time of a disaster. And Narmon is a boss is a mart in Thailand, and Narmon, no. And I like to explain the Japanese situation. First is the DMAT. DMAT is in the little bit unique emergency medical team. That focus on the medical care for saving severely injury. That team member is almost always the emergency physician and the traumatologist, and they usually work in the critical care medical center. And then assist disaster casualty receiving hospital, and then triage, treatment, emergency surgery, and activate medical air land evacuation, and support and such urban search and rescue, and support to medical care at shelter 1 or 2 weeks. That is very important. Support to coordinate activity in health EOC, yeah, 1 or 2 months. I think that's very important. For in the Japan, East Japan, that time, many DEMA teams gather at this disaster area. Within 12 days, 380 teams and over 1,800 personnel are deployed in the affected area and support the EOC and the health EOC, support the hospital, inpatient evacuation, regional evacuation, and etc. And we have this is the, not only the acute phase, but also the lot of medical team, and ordinary, that means the acute and subacute phase EMTs. Japan Red Cross medical team, we have a lot of medical team. And the Japan Medical Association team, that the Japan Medical Association is a big organization. Almost all doctors belong to this Japan Medical Association. And the National Hospital Organization medical team, that belongs to the MOH. And this upper three team belongs to the governmental team. But another is almost a non-governmental team. And that red color is important. That team shown in red are deeply involved in the medical care, the nursing care for elderly. For DPAT, disaster psychiatric assistant team, disaster welfare assistant team, Japan rehabilitation assistant team, Japan dental alliance team, Japan nursing association team, public health nurse association. That team is focused on the elderly person. Okay, that means the EMT adapted to the phase of a disaster. That's a subacute and the chronic phase. This EMT activate. Okay, and then standardized. This team all use the same EMT tool, use the same medical record, and standardize the surveillance sheet. And this team has to send a daily report. That's the same in the WHO MDS. That many teams send a daily report to the EOC. And it's very easy to analyze the data in the EOC. And standardize the essential drug. After big disaster, all EMT or organization gather and make selected 82 drugs, essential drugs, and then the packet. And local government send this package to evaluation center or etc. And standardize the rapid assessment sheet for evacuation center. I think Thailand also upper standardized too. Maybe now will make this kind of standardization. Yeah. And then this is a real situation. Last year, the number Noto Peninsula earthquake. This is the number of deployed emergency medical team. DMAT, over 1,000 team. Red Cross, over 10,000. JMAT team, so many EMT deployed to the acute area. And subacute phase, many red team visited here. And then now improving the evacuation center. Upper picture, that's very crowded, and the floor is very hard. It's very hard to live in the elderly person. But now, on the floor, we use that downboard bed and separated family and etc. This right side, that tent, this is a very special evacuation center for elderly person or disability. This not earthquake, Ishikawa Prefecture government set up this kind of shelter for elderly or disability person. Okay, improve the circumstance toilet. In Japan, almost all toilet is a water flush toilet, but at the time of a disaster, shut down the water, and then up like this, yeah, and then now we move to this kind of a toilet for the shelter. And also, Japanese Association of Disaster Medicine conducted this basic health emergency life support for public. And then many nurse and social welfare team participate in this kind of seminar course to coordinate and manage the shelter. Yeah, that's all. Okay, that's a pharmacy card. Okay, that's all. Thank you very much.
Thank you, Professor Kai, that very kindly that sharing about the experience in Japan. That we learn a lot. I think the most of thing that I really impressed on this one, that for the how prepare, because Dr. Professor Kai talking about the many disaster that not only the tsunami, right, volcano, and also the flooding and other things that occur. So the thing that the knowledge that from Professor Kai, it will be very good for us to learning. So for Thailand, may I have my slide? For Thailand, I will take talking about the what we have disaster preparedness for elderly in Thailand. So next slide, please. Oh, for myself. Okay. Since the 2006, we have the big disaster in Thailand we call tsunami, right? Occur in the southern part. I think this one that this is the biggest tsunami that in Thailand that we face with the death, more than 5,000 death, and also more than injured. I think at that time almost more than 10,000 cases that we have. The important thing that we learn many things on that, and also at that time we have many problems about the team emergency. We could say that at that time we have the chaos. So the municipal building have the policy on that one. And this is the headquarter operation support for the national EOC. The disaster Department of Disaster Preparedness and Mitigation has set up for we call the National Disaster Risk Management Plan, and the organization revise every 5 or 10 years on that one. And for the Minister of Public Health, we focus on this one. This one is you cannot read, but you can look at them. For medical care and services system that we will working on that. The Minister of Public Health also have the Public Health Emergency Operation Center. We call that Public Health Emergency Operation Center, which the head of the chairman of the Public Health EOC is the permanent secretary that will be on the chairman on working, and also we have many department. The primary agency will be the office of permanent secretary, which have the more than 800 hospital in each province, and also Bureau of Public Health Emergency Response. For my department is a Department of Medical Services will focus on the medical service system, and also we have the many department, mental health, Department of Health, and also health service support, and Department of Medical Services is under the Ministry of Public Health, and also the other agency that will work together when we set up the Public Health EOC is a national for the NIAM, right, emergency medicine, and also the Red Cross, and also the military, including the Ministry of Interior and also the Ministry of Foreign Affairs, and other will working together on that. And in Public Health Emergency Operation Center, we will have the team working on the situation surveillance. Now we surveillance on the not only the disaster but also the other disease. For example, we have now faced with the cholera outbreak in last month, right? Cholera outbreak near among our border, and also now we very concerned on the avian flu, because now is from the history of the pandemic flu, it might be come back very soon within 1 or 2 years in the future. And for the disease surveillance and also communication, public health relation, and logistic and other support, this working on the public health EOC and also the networking. For the medical services and referral system, we will discuss in the detail on this one. So the public health EOC not only the working on the medical care, but they also concerned on the disease control, surveillance, prevention, and also the food, water, sanitation. So every time that we have disaster, we will set up, it depends on each level. For example, in Thailand, we have the smallest is a district. District will set up this, but if they have the higher level, we call level 1 is a local, level 2 is maybe at the provincial level, level 3 is will be the many provinces that have disaster, we will have the regional, will be the inspector, will be the chairman, and also if in level 4, the Minister of Public Health will take action on that one. And for the medical response team, we will have Public Health EOC we call Command Control Center in each level, as I told you that in district level, provincial, regional, or the ministry or the national level. And in the normal situation, we have the emergency medical team, or we call EMS. You can see the basic life support. For example, foundation, or in Thai we call Muniti, ร่วมกับตันยู protecting other thing on that one, and also advanced life support will be in each hospital. Mostly have the nurse and doctor. And mini-MERT is in each from the policy of ministry. For mini-MERT is composed of 5 people, 1 doctor, 2 nurse, and 2 emergency medical technician or 2 paramedic will focus on with 1 ambulance. In one district, we'll have the 1 mini-MERT team will be assessed. And for the MERT team is the medical emergency response team. In each province, we will have the medical emergency response team or MERT team. And for the prevention and control, we have SR team already now we call JIT team or something like that. And health promotion. And also we call buddy system. It means that for Thai, we have 77 province. If one province A have problem with disaster, province B will be the buddy system to work, help each other before we come to the ministry level. And for the role of the team in disaster, for the search and rescue team from the Ministry of Interior, we have the ERT, we call emergency response team. For the military, they have called search and rescue team. They call SAR team or SMOT team. SMOT is stand for Special Medical Operation Team. We're working mostly in the war or something like that for the military. For the EMS or mini-MERT, this team is working as an initial assessment and will transfer the case. And for the MERT team will be emergency, and we could call that MERT team is like the emergency room, mobile emergency room, working on that one. So for the medical emergency response team, I will focus on this, so we will call on this one. The compare between mini-MERT and MERT team. Mini-MERT have composed of 5 to 6 people. As I told you, have 1 doctor, 2 nurse, and 2 emergency medical technician. With ambulance, they training for 2 days. And this year we will revise for the training course for the mini-MERT. It will be in the beginning for the training. They mostly focus on the disaster initial assessment. But now we will plan for more on the other disease outbreak. So they will working more. And for the MERT team, we have about 17 to 20 persons with the multidisciplinary team. They have 2 doctors, 4 nurses, and 6 EMT, and also the pharmacy. This one training for 7 days, 4 days for in the lecture room and 3 days in the field. MERT team is now is the policy of the Ministry of Public Health that every hospital, every province need to have MERT team. So they compose of the multidisciplinary volunteer. This season have to be volunteer because in the disaster we know that we will face with other big problems. So they will have the very important thing. And also the concept is that medical operation response in disaster area, they are readiness and rapid deploy, and they have to sustainable on this one. They focus on the mission on treatment, triage, and transfer on this one, and also for the sanitation and healthcare for the victim in shelter. This is in the, for example, the training in the class for the medical, for the MERT team, and also in the field that they're working on that. So the concept of MERT team is that for the MERT law, that when we have the cases occur for disaster, for example, this one occur after the tsunami. Because tsunami, we don't have the MERT team. And also we start in the, and also we have the mega flood, right? For the mega flood in the 2011 on that one. So the team have set up on after that. So we, after working closely with the search and rescue team, they will send the patient to MERT as the emergency room, mobile emergency room. They will triage treatment and transfer to the tertiary care. So summarize for the concept of the response in Thailand. In each level, we have for the disaster, for preparedness, 2P and 2R. First one is preparedness for prevention. For the response, we will prepare for the logistic support and other medical care. This one not only in general for the elderly, they will focus on that, how they will have the logbook in each level, in the district level and also in the sub-district level. They have the logbook that have the name list of the elderly, and they will know that when the occur. I will show you in the picture later that on that. So the district level we have mini-MERT, provincial level and also regional level we have MERT team, and national level. For the response team also we have also the special care is depend on the situation, and for the rehabilitation. And the last but not least, for the mental health, we have the team we call MCAT. This one are really important to working on that when every situation. So now we have the 77 MERT under the Ministry of Public Health. We also have the 6 military MERT, they call MERT, that working on that, and they try to produce more. And also we have 2 Navy MERT that in the Thai. For the now, after we apply for the EMT, what is EMT? Is a Thailand EMT is a global of the under the WHO, and Professor Kai is also is my what we call is the mentor to help us on working on that. In Nepal, 2005, that MERT Thailand, Nepal have earthquake. I think you could remember at that time. So the Ministry of Public Health in Nepal asked for assistance. We sent the MERT team to Nepal at that one, and also to help working on that one. And from that experience, I think we applied for the emergency medical team in the this one they're working in that one, and we found that many experience in the earthquake, because at that time we in Thailand we don't have experience on earthquake, but from Nepal we got many things and then come back to set up the training on that one. And also the 2018 we sent up the Lao that have the Attapur, they have the dam collapse. So the thing that we send the team also to Lao to working on that one. And also in flooding in the northern part, I think last 2 years ago, that we have the problem. We found that mostly of the patients are elderly. And at that time, we talking with the team how we working on that. So the local health, they said that they have the logbook. But when the flooding occur, they don't have any road. They just have the flood. The thing that they just thinking just for the symbol that how they help the elderly people, because some people they cannot move out, so they have to send the team. So for example, this one in the 2023 that we working and help the elderly people to working, and also the military and also other foundation that are really helpful in the local people. So they send the people to help, and they found that every time that they have the elderly people have the stress, as Dr. Professor Ka and also Dr. Rick talking about the concept that we found that mostly have the depression and also the found with the chronic disease that they have occurred with that one. And last year 2004 that we have also the big flooding, also the mostly in Thailand, that community that we found that mostly of the young people working in the big city, but they will send the money to the elderly people in the rural area when they face with the flood, the disaster, or the thing that sometimes they could not move out. And we found this one is another lesson learned after we working on the lesson learned how we help them or prepare on that one for especially for the elderly people in that one. And this one in the northern part, I think September or October during at that time, in northern part we have the landslide that have the Masai, and also in the Chiang Rai, that problem that they have the thing that the many patients that have to face with the disaster, and also they many not only the psychotic and also the disease and other thing that we face. So they request that need the help from the people to help. So we could say that during the disaster we have the volunteer team from any region of Thailand to when they went to, they will report them to the EOC of the district level and also the provincial level. They will know that where is the place that should to go. So the thing it will help now they set up, we have using in Thailand, we using Line, the social media. Line is they will talking that after the patient have during still have the electricity, but another problem we found that for the flooding, the electricity have the patient with the shock, the electric shock. So the thing before they talking about that before they cut the electric shock, they need to have the power bank or something like that to concern on that. But however, the thing that some people, elderly people, they don't want to move out because they say that it will be more safe if they can stay. So if they have the 2 floor of the house, the volunteer will help to go them. But if they have the problem, we will take them out to see the doctor for we call the shelter or the mobile shelter or mobile hospital or mobile OPD of the team. For example, this one the shelter of the elderly people that we have. This one we using sometimes we using in the temple, sometimes using in the school. It depends on the shelter of. So the MER team in each hospital or in each province will have been there on that one. And this is I talking about the landslide in northern part of the 2024 for the landslide that unbelievable that this one is the top of the mountain, but when they have the landslide and the water, the original of the water in the top of the mountain, but when the flooding, when they have the heavy rain more than 2 weeks, the thing that the landslide occurs, so the people cannot come out, so we have to visit them on that one in the area, and also this is the flood, so we have to help them on that one. And not only the flooding that we found with the disaster in Thailand and also COVID pandemic. At that time, we found that the mostly of the patients that die from the COVID, from the respiratory failure, we set up the few hospital in many places. Not only this one, the first hospital, I think at the end of 2021 that we set up using the temple in Samut Sakhon that many people come. So after set up the team working on that, and from that experience we found that so if we need to preparedness for our healthcare worker and also for the community, we need to give them not only the other disaster but also the disease outbreak. That also is another important thing to help the people to preparedness on that one. This is one, so we also have we call the telemedicine, talking with the patient to this one in one of example. So in summarize that for the disaster preparedness in Thailand, that we have the training for the team all in all level, district, sub-district level, and this year we plan to expand more to the community, to also the school, to prepare them to how they working on that, and also the provincial level. In addition, after Thailand have working with after we working with the WHO, and WHO said that if we are the Thailand EMT Taiwan fix, and we need to reclassification to the Thailand EM2 Thailand EMT type 2. For this one, that we plan to training more team, so we expand for other, not only we call not only the MERD, but we training them as the advanced MERD. So this year we will have the more training for advanced MERD, and also we will plan to set up the advanced MERD become the Thailand EMT in each region. Thailand we have the 13 zones, and also we have 4 regions, so we plan to have the EMT Taiwan fixed for the Thailand EMT in the Thailand. So that's all for the Thailand experience on the disaster preparedness. Okay, thank you for this one. Okay, for now, I think in summarize, now we share experience for the global EMT, global preparedness for the elderly, and also for the Southeast Asia and the WHO concept. Professor Kai also shared the Japan experience on that one. So I think for the now it's time to floor sharing experience for the question. Or you want to add anything before? Just one sentence or one word before that. Please.
Yeah, I mean, maybe just one thing I can share is that, so I normally work on emergencies, and I have in our regional office my counterparts who work on emergencies. In our office we also have people who are responsible for aging, and they have their counterparts in the regional office. And I've said to you that we have this new strategy for focusing on health for the elderly, and it has this component on emergencies. But just since I found out about this, my colleagues in the regional office working on emergencies are very keen to develop some more specific guidance. So they've asked me if I and my national officer, Dr. Alisa Yanasam, would be interested to further elaborate some guidelines. But they've also said if we can identify some people in Thailand that will help with this, then that would be great as well. So it's really a message to anyone in this room. If you have some specific interest or expertise in this area, and you would like to connect with us to support the development of some guidance for our region, then I'd be very, very happy to hear from you.
Thank you for good news. So anyone interesting, please contact us now. Okay, Professor Kai, you have anything that to add more? Please.
I want to emphasize that local government that separated the welfare EOC and the medical EOC that are different. But elderly population usually belongs to the welfare section. But soon, at the time of disaster, they will be very easy to get illness and shift to the medical section. And then most important is information sharing system and between health EOC and welfare EOC, and also nursing care facility and hospital and clinic, and how to get information, sharing this all. That's a very important and very difficult.
Thank you. So Professor Kai tried to explain for the EOC that it's very important to work in when we have the disaster on that one. So now it's time for the floor. Any question or any experience want to share? Jaika? Want to share anything? Please. Yes, please.
Thank you very much. It was very, very impressive presentation, and we learned a lot from all of your presentation. My question is, the vulnerable person, including the older person, are, I think, very quiet when the disaster happened. So I think we as a medical personnel, we really have to take care of them. However, we have to find them because probably they are living alone or they don't have a voice to say, I'm here. So how we can find them to take care of them quickly? I think each country have a different way, slightly, but we would like to know. Thank you very much.
Thank you for a very good question that how we identify the elderly people during the disaster. For Thailand, as I told that we have the logbook. So for we need the volunteer, we call Osamo, volunteer, health volunteer in the individual. They will know, have the list of the name. So from the flooding, many times that we learn that, for example, during the 2011 that we have the mega flood, the thing that they do, they use the flag, the red flag, green flag, and also yellow flag. If they have the flag in the front of their house, that they have the people that need help, very emergency, sometimes they cannot move, they will have the boat and then come to the house at that one. That's for example. How about Japan?
Yeah, that's a very important. And I already mentioned that a local government has a list for an elderly person. But it's a very sensitive data. That's personal data. And then it's difficult to open that there for community. But the community leader knows the list. And at the time of disaster, she cares. I think that community is very important. And the community knows. But I don't know the urban area, that the community is very poor, but the rural area, and so most important, education for community. Yeah. And I showed the president meeting, and then a community leader gather and around the disaster, for example, the hazard map and the evacuation route and etc. That is important. Through this meeting and drill, community know where is the elderly living alone or etc. That kind of issue. That's very important. Thank you.
Thank you, Dr. Kai. Professor Kai talking about the community, right, on that one. Dr. Lee, you want to add anything?
Well, yeah, I was thinking about how I would respond. I mean, so speaking as someone from the United Kingdom, we actually don't have many large-scale disasters You know, we don't have earthquakes, we don't have volcanoes, so on. But I mean, but everyone,
Yeah.
because of the way our health system is structured, everybody is registered with a family doctor. So they have all that data. But I don't think they really look at the data through the lens of disaster preparedness. But, you know, I think it would be possible to do that relatively easily. So we just have, I mean, and we are going to get more extreme weather events. You know, we do have hurricanes, we do have flooding, at least.
Yeah, thank you. So to answer your question on that one, thank you. Any question or any want to share experience? มีไหมคะ เชิญค่ะ
Thank you. Thank you for sharing very interesting topic. I have some question. When I go to Japan, that I see commercial kits about a kit for preparing for disaster sell in department store. So I want to ask how you raise awareness about how to prepare any kit for before disaster happen, and are there any advice for Thailand? Thank you so much.
Professor Guy, is for your the question is about the kit in the convenience store for the kid, right? Convenience store. She said she studied in Japan. Oh, okay. She visit in Japan and she found that have the commercial kit, something that for preparedness for the disaster, right? So could you have the question is that how Japan or have the any policy for the people to training or anything that to buy the kit ยกตัวอย่างได้ไหมคะไฟฉายอะไรนี่เปล่าหรืออะไรนะ
Equipment for a disaster I see and it can easily see in the department store ค่ะ emergency bag preparing for disaster I saw them in some for example Eon Mall or something yes and I think this is very helpful for someone who don't have a time to prepare whole of thing yeah some of toilet what should I say toilet for that and some water kit have anyone ever see that too I saw that in Japan and I saw it's very interesting ขออนุญาตเป็นภาษาไทยคือเหมือนมันเป็นอุปกรณ์แบบฉุกเฉินนะคะอาจารย์
เข้าใจเดี๋ยวอธิบายอาจารย์เขาอยู่ค่ะภาษาอังกฤษเนาะ
You mean the education for the community?
เขาพยายามอธิบายว่ามันเป็น education committee ที่เขาสอนอยู่อะค่ะประมาณนั้น
Okay, and almost every local government, in Japan, some block and the district have the autonomy. How to say that? The community, and then we have a community leader, and inside this community we have some committee of disaster preparedness, and then the leader. And then leader say that maybe 2 times or 3 times a year and I gather at the meeting. And then sometimes fire department participates in this meeting and police department participates in this meeting. Of course the local government and they make a meeting. And then for example at the time of earthquake, how to do and what to do and what thing is very priority high and etc. For example, and learn the hazard map. For example, in the coast area, this area is covered by the tsunami and have to evacuate this area to the higher area. That's this kind of a route. Yeah. And if vulnerable person living there, how to do, what to do, who support, what are limited type. After the earthquake, after the ground motion, how many tsunami reached this coast. We learn that kind of this. And then continue to this education. Because aged people die. new, you understand? Yeah. Most important is continue this kind of education for residents.
อธิบายภาษาไทยแป๊บหนึ่งเดี๋ยวลองแปลดูนะคะเพื่อคนไทยอาจารย์เขาบอกว่าจริงๆเดี๋ยวประเทศญี่ปุ่นเขาจะมีกับเรื่องชุมชนเขาจะมีผู้นำชุมชนที่สอนให้กับทุกระดับแล้วก็จะมีทั้งหน่วยต่างๆเข้ามาจะเป็นตำรวจเป็น department store ต่างๆเข้ามาพอสอนเสร็จปั๊บเขาก็จะกลับเอาไปทำแพ็กเกจต่างๆซึ่งการสอนเนี่ยก็จะมีการฝึกด้วยดังนั้นก็เป็นอีกสิ่งหนึ่งที่ถ้าเราเอาสิ่งที่เรียนรู้จากอาจารย์จากของญี่ปุ่นนำมาปรับในประเทศไทยน่าจะเป็นประโยชน์เยอะมากก็ขอบคุณน้องที่ถามนะคะว่าเพราะสิ่งที่น้องเห็นนี่ก็จะเป็นประโยชน์ต่อไปว่าในอนาคตถ้าเราจะเตรียมความพร้อมตรงส่วนนี้คงไม่ใช่เตรียมเฉพาะผู้สูงอายุแต่ต้องเตรียมทุกทั้งคอมมูนิตี้ทั้งชุมชนนะคะทุกกลุ่มเพราะว่าในที่ของญี่ปุ่นเขามีโรงเรียนสอนเนาะเขาจะมีชุมชนต่างๆแล้วก็ชุมชนก็จะสอนว่าเนี่ยถ้าเกิดภัยต่างๆเขาสอนปีละ3 ครั้งอะค่ะ2-3 ครั้งประมาณนั้นค่ะตอบคำถามไหมคะ
ตอบคำถามค่ะขอบคุณมากค่ะอาจารย์ Thank you so much for answer my question
อีก5 นาทีมีใครจะถามอะไรอีกไหมคะโอเค if no more question we on behalf of for my moderator we would like to thank you Professor Tatsuro Kai from the Osaka Seisekai Senri Hospital from Japan that kindly to give us the experience very good on one and also Dr. Rick Chadbao Program Manager Health Emergency and Antimicrobial Resistance from WHO Thailand Thank you so much for sharing with us ขอบพระคุณนะคะ
Thank you very much. Now we will break for 5 minutes for refreshment. Thank you.
just 1 2 3 4อันนี้1เนาะ2 ผมเปิดไว้เลยนะได้ครับจื้อพูดอยู่3ป่ะจื้ออันนี้4 1 2 3 4 5 7 8
Hello.
2
Welcome back. Everyone, please be seated as our session is about to begin. Now we will come to the last session for today. We will discuss the national policy on social welfare and human rights for the older person. This is an essential conversation as we consider the policies that shape the life of our elderly citizens. Now, I would like to invite Dr. Nathapon Suthi Suntarin, Institute of Geriatric Medicine, Department of Medical Services, and Dr. Parisha Suntararak to moderate the session. The floor is yours.
Thank you very much.
Good afternoon, distinguished speaker and all participants. I'm Nathapon Suthi Suntarin from Institute of Geriatric Medicine, Department of Medical Services, Thailand.
And good afternoon, I'm Dr. Parisha Suntararak. We will be your moderator for this session.
Welcome to this international session IN6 of the 5th Thailand Elderly Health Services Forum 2025. Today's session focuses on a critical and timely topic, national policy on social welfare and human rights for the older person.
And thank you very much for staying with us and joining us for the very, very final session of the day. It's going to be a little bit difficult, so we will make it.
Our distinguished speakers today bring diverse expertise from Japan, Singapore, and Thailand. And we are confident their insights will help us understand how different nations are addressing the challenges and opportunities associated with aging society. Today we have three speakers. Kun Suthida Konglet Mongkol from International Cooperation Subdivision, Strategy and Planning Division, Department of Older Person, Thailand.
And another speaker, she flew all the way from Singapore. We have Ms. Anurada Kalipan, and please allow us to call you Ms. Anu. Okay, she is the principal medical social worker from the Medical Social Services in Singapore.
And Professor Yutaka Horie from Fujita Health University, Japan.
And in this session, all speakers will share your insights and your experience from your home country to the floor, and how you design the policies and also how you support your people in your country. Each speaker will have about 20 minutes to present. And after all three speakers ended their presentation, then we will have the Q&A session. Okay, so let's get started. We will start with Professor Horie. He brings with him his extensive experience as a former bureaucrat with the Ministry of Health, Labor and Welfare in Japan, where he played a key role in shaping national policies on social security and also social welfare for the elderly. In addition to his work in Japan, he has served as chief advisor for a JICA technical cooperation project in Thailand, providing him with deep insights into aging issues, or not only in Thailand but also across Southeast Asian country. So giving with his expertise and also comprehensive understanding of aging related challenges, Professor Horie is our highly recommended panelist today. So the floor is yours, Professor.
ทุกท่านสวัสดีครับสบายดีไหมครับ I try to make my presentation as interactive as possible, so please speak up. Then if you are very quiet, I say my hand, something, hand me die, something like this, so please. Okay. Human rights and social policy for older persons. I have maybe 25 or 26 slides within 20 minutes, so I will do it very quickly. But I will use more time for thinking together, as I said. This is brief professional history. It means I worked for government more than 30 years, and then I had an office at Ministry of Public Health and Ministry of Social Development and Human Securities for 3 years. between 2007 2010 in Thailand. So I have many friends here today. Most of them are very senior. Senior means not high position, but just old. Person are you? Okay. Well, this is just an introduction. You know that the physically longest life expectancy, highest level of elderly proportion, and then I see many Thais visiting Japan at this moment due to cheap yen, safe living conditions, and low crime rate, and traffic accidents low, much lower than Thai. And then we have universal health coverage, pension coverage, and also we created in 2000. This is wrong. I mean, not 1963, but year 2000, universal long-term care. And then this is population pyramid. And then just after war, not just after war, 10 years after that, I mean 15 years after the war, we see the red lines showing baby boomers just after the war. Then we have 2025, that biggest portion of population is now, this year, turned out to be over 75. So our high aging, super aged society is coming more. And then maybe in 2040, we are seeing them like passing away. This is just natural tendency for elderly decline in many physical things, and then isolation, loneliness. And then economic side, very wide gap between the rich and the poor. So we don't say just they are poor. Many of them are very rich, but some others are very poor. So big gap. And then social characteristics, naturally easy to be isolated from family or community, and also difficult to catch up with latest IT and technologies and gadgets. So you cannot try to teach people with over 90 how to use iPhone or whatever. Not so successful. Some of them get very interested. Okay, so desired policy direction itself is promotion of healthy aging and family community support and network. Okay, this is all about what I'm talking today. And then this is just an takeaway, like what is the comparison? I mean, major demographic indicators. And then Japan, Singapore, Thailand, one of three of advanced aging society in ASEAN +3 areas, especially Japan, and then Singapore, Thailand, similar in the kind of second group just after the Republic of Korea. But the doctors, Your Excellency, the Minister Somsak yesterday explained Thai elderly ratio is 21%. It means he uses elderly plus 60. So as I do this like this, so your ratio is 21. This is from UN stats, so maybe you use different one in domestically, but the Singapore 18.5, and so compared to 21 and 29. It looks like similar, but we are still ahead of you, 35.6% if we take elderly as over 60. Okay, introduction. What is this? This is a crime steep. So this white hair person, I just say, Mr. Japan, something like this. And then Miss Thailand and Mr. I don't know, Singapore, something like this. We all have to climb, walk up a steep hill toward aging society. This is the image Asian societies face at this moment. Maybe Japan is in the front, at the front, but the Thai and Singapore or even South Korea are catching up even more rapidly than Japan. But so maybe Japan keeps its position for long, but the difference between second group becoming smaller. Okay. This is just social policies for the last 80 years. Well, if you are so much interested, I will come here again for this one. Okay, as I said, we in Japan are living in safe, sound environment, but some noises are there surrounding older persons in Japan. What is it? What is it? Is there anybody volunteering what it is? Huh? Yeah, yes. I'm old enough. I cannot hear you so well. Scam, yes. It's me, fraud. It's try to make direct translation from Japanese. Me, fraud. Like so, the young person somehow got the number of elderly people, and then, oh, mother or grandma, this is me. I am in trouble. So then the awkwardly, the elderly people dash to bank transfer to save fake grandson. So crimes were, so elderly people, elderly people are easily deceived by these scams. Okay, next. Is there anybody who can tell me what it is? Yeah. Scam. Not that not quite scam. Dark part-time jobs. So it may say white. Then it will take young people into the crime group. Then once you are getting in, you are not allowed to get out. You will be threatened to ruin your entire life or whatever. So once involved, targeted young people are threatened, uneasy to get out. Then wealthy but isolated older persons are most likely to become victims, like just assault, like robberies, whatever. So, what it is? Do you have any idea what I'm going to tell? Okay. Caregiver fatigue homicide. So caregiving stress drives family members to harm the bedridden care recipients, often linked to isolation and lack of support. And some different, but we do have some other pattern, topics like elderly care by elderly, or young carer, college students forced to leave study for care support of bedridden grandpa or grandma or sick parents, something like this. So these are caused by, from my interpretation, isolation from society or community. So why did I introduce these topics is older persons, especially those living alone, are easily deceived. And then those living alone are helpless against external enemies. And then family support is endless and difficult to take a leave. Family members are easy to feel stuck. Oh, I cannot do anything else but care something. What I try to summarize is vicious cycles elderly people may fall into. So I try to emphasize, don't try to repeat older persons are weak. Sometimes weak, not always weak. That is my message. So one problem is vicious cycle is overprotection. Visitors are the risk getting infectious disease, maybe. And then going out can cause unexpected traffic accidents, maybe. But these precious opportunities for going out or inviting visitors for interaction or contacts with outside tend to be deprived or limited if there is overprotection. And then in the name of protection, elderly people get into isolation more easily. And then their self-determination will be lost and may develop their dementia. The other view is over-reliance on social support, service, or government. Over-reliance may squeeze the potential ability of elderly people. Social service may be interrupted or reassigned to other priorities when disaster comes, as just Dr. Kai explained. And dependence on government raises costs and make the government lose rationality or flexibility. I noticed quite strong that any incident may lead to blame the government's failures or shortcomings. Then our government becomes more tensions or not to do any mistake or whatever. It will make a mess or inefficiency. Focus of policies is extending healthy life expectancy is once the top of the thing. So you keep your strengths physically, mentally, and economically. Then your health remains or even improves. This is also takeaway. Like healthy life expectancy and life expectancy. So there are two important things is historically how healthy life expectancy improves. Like Japan between 2000 and 2021. 2.3 years, Singapore 4.2 years, very good. And Thailand 3.5 years, very good too. And the other one is a difference between healthy life expectancy and biological life expectancy. Of course, you live longer than live healthy. So how many years of difference are there? Is Japan 11 years, Singapore 10 years, Thailand 9.5 years, very good. But if the expectancy tends to be, short, the gap is also tend to be short. Okay. And then second, after healthy life expectancy, Japan focus on frailty. Frailty is just between the middle place between very healthy and bedridden or necessary for constant care. So then, we heard from specialists that progress of frailty is considered reversible with appropriate strength training and nutritional improvements and participation to social activities. There are nutritionists today coming from Japan. Okay, so that is the second one. And third one is rehabilitation from hospitalization day one. You don't want to miss the opportunities for recovery. Okay, these are the health side, but the social side too. One is community comprehensive care. We do seek cooperation from clinics and nurses, and then rehabilitation therapists and nutritionists to support in lengthening home living, and so that they can keep independent living. And then also we do have established a basic law on dementia, not only for dementia, but promote inclusive society. Well, those who with disease or handicap or any difficulties, maybe divorced, whatever, or poor. Japan, maybe together with all of you, for today's participants, we go for inclusive society. We do have made a new law for basic law for dementia, and it seeks inclusive society. Conclusion, healthy and independent lifestyle and extensive network to live well at home are important to keep and increase the rights, human rights for the elderly. Yeah. Yes. So, thank you very much indeed.
Thank you, Professor, for sharing with us the current situation in Japan society, and also share with us the social threats that elderly people in Japan are facing, and also the characteristic, the cycles that elderly people may fall into, the policy, and also the initiative that you are trying to prevent and protect the elder people. Thank you very much.
Okay, next we welcome Miss Anu, also known as Anudra, is a principal medical social worker at Changi General Hospital in Singapore. She specializes in providing support to older patients and their caregivers, particularly those managing dementia. Beyond her clinical work, Ms. Anu is deeply committed to education, mentoring, and training new social workers and healthcare professionals to ensure the delivery of high-quality care for the elderly. Her dedication to geriatric social work has been recognized with multiple accolades, including the prestigious Best Educator Award at Changi General Hospital. So, Ms. Anu, we would like to invite you to share your valuable insights with us.
Hello. Hi. I want to say a few words in Thai. I just learned yesterday. I just want to say Sawadee Krap. Washin Chi Anu. I'm sorry if I pronounce it wrongly. Okay. I'm really happy, to meet one of my fellow, social worker from Thai. And I hope that I will see more social workers that coming to this forum. And yeah, so I will go into the sharing. Okay, so this is the outline for today. So I will be sharing about the outline, talking about the overview of Singapore population. I will go through quite quickly because yesterday, Dr. Goh, my fellow speaker from Singapore have covered. And I also will go into the national policies in Singapore and as well as the healthcare system in Singapore, the philosophy of the healthcare system, and as well the financial assistance in Singapore. What are the protective legislations that we have in Singapore, and what are the challenges and the future plans for Singapore? And of course, last and not least, my role as a medical social worker and my fellow social workers. Okay, so this is the overview of Singapore population. If you could see, I think Professor Hori also mentioned earlier, telling us how the populations have changed. And if you could see, the current populations that we have in Singapore is about 6.04 million. And out of this, so we got not only Singaporean and, we have permanent residents, we also got foreigners that, come to Singapore. So if you could see that 4.18 million are actually the residents population, which is inclusive of Singapore citizen and our permanent residents. And what I would like to highlight today is actually our whole age support ratio. So if you could see the below table, you can see the key demographic indicators over the years from 1980 to 2024. So if you could see the last, two lines, how the support system for old people, for seniors actually changed. It means that in 1980, we used to have 11.3% supporting one senior, okay? Now, we are actually having 3.5% supporting one senior in Singapore. So the challenges is happening because less people are giving birth, and the life expectancy of older people are getting longer. So our older seniors are living longer as compared to the number of people are giving birth, right? So you can see that, we have in projected in 2030, we will have about 22.1% of Singapore residents who will be age 65 and above. And I just would like to also highlight that, we do have a lot of centenarians, people who are living, above 100 years old. Okay, so you could see in 2007 it was 500, and now in 2024 it's about 1,005, and we will hit about 2,000 in come to 2030, right? So you could see also how the aging pyramid actually changing. It means that the older population getting wider and the younger populations are getting lesser. So these are some of the policies that I will share that we have in Singapore, and these are the key areas that we cover in Singapore. Okay, so the financial security, where our Central Provident Fund is known as CPF. Later I will cover more what is CPF means. And we also have, so under the CPF, we have one of the insurance scheme that cover our medical expenses. It's called MediSave. So the government do top up our MediSave top-ups. When we meet the criteria, when they don't have enough MediSave, the government help to top up so that they are covered in their medical expenses when they are admitted to hospital. And we also have a retirement sum topping up scheme. This is for our aging society when they are retiring and they don't have enough retirement fund. The government also help to top up their retirement fund. And we have our Housing Development Board, HDB stands for Housing Development Board. So this is a lease buyback scheme. It's one of the scheme because the CPF, one of the goal is also all the Singaporean, we are hoping to have a fully paid house by the time we retire. Okay, so some of us are probably by then they have a house, but they may not have a cash. So what the government has is actually they can sell back in a lease the house that they have, and they continue to live in the house, and they can receive a monthly payout from the government, and they can use that to their day-to-day expenses. We have a financial assistance and a financial grant, so we have a wide range of financial assistance. Later I will cover some of it, but I also have some attachments, so you can refer more in details. So the financial systems, how we do it actually based on our national mean testing system. So it means that the needy were eligible for higher subsidy, and the lesser, people who are more richer, they may not, eligible more subsidy. So they actually have a self-reliance. They're able to pay from their own pocket. So those people who are needy, then they may not have the means to pay. Then the government support them better. Okay? So there's a silver support scheme. These are the people for seniors when they're retired. They don't have enough retirement. Okay, so the government then help them with a retirement fund. It's called a silver support scheme, where they can use it for their day-to-day expenses. And we also got the goods and services tax vouchers, so GST, so we do need to pay tax, right? All the things that we buy, we pay our GST. So what happened is the government helped to support those who are needy, household, when they are able to spend some of these tax rebates to pay for their day-to-day expenses. So they actually paid in terms of the cash, in terms of their Medisave, as well as their some of the rebates for their housing rental schemes, and as well as their town council charges. Okay? And next key area is actually the healthcare initiative. So some of the policies that actually help. So you could see, right, we are actually trying to expand our healthy life expectancy, right? So I have to say that we are doing very well. That's why we managed to narrow down the gap, okay? So it because our health promotion is actually focusing on the disease prevention, promotes personal responsibility. Everybody responsible for their own health. And how do they want to remain healthy and active? It's in your hand, right? And we have, how do we then support the individual, to stay healthy and remain active? We have a chance, it's a community health assist scheme. It's a financial scheme that, providing a subsidy when they're actually seeking early, consultation or early seeking medical treatment in the general practitioners or the doctors within the community. Or they can also get a subsidy for their dental treatment. Okay, earlier morning we heard about how important dental care for our older people. So it's also covered the dental treatment subsidies. And we have a pioneer, Merdeka generation and the modular packages. So this is covering at the different age group of our pioneers who are born, in Singapore, and they are the ones contributed the growth of Singapore. And that is how the government actually paying back to them to pay the contribution that they made to the country. So there's a different age group of the generations that we cover. So we help them with the topping up with their Medisave, and they may eligible for some of the support schemes that they're actually entitled under the schemes. And I would like to highlight the Healthier SG. So this, as long as when you reach 40, you will be able to enroll yourself in a scheme that's called Healthier SG. So it's really that we are talking about health prevention, right? So you go for your early screening. So you can go for your chronic disease, management. You go for your screening, and you go through with the doctor the health planning education and the required, vaccinations that need to be in place. So these are the things that when you reach 40, the government encouraged us to go for our GP, our own GPs that nearer to the house, nearer to your residential area. You can register with them, for their consultation. So I myself, I would say I already done my LTIG subscription as well. Okay, so we do have a Live Well, Age Well, which is cover Live Active, okay, Live Enrich, Live Assure, and of course Live Happy, and Live Prepare, and Live Nourish. So if you could see that it's a wide range of the things that the policy cover, where how do we want them to be active? How do we want them to be able to make their decision? How do we want them to assure that the government is there to support them? How do we want them to live happy and connected to the society and the people around them, okay? And how do we want them to be prepared, how do they then aware of what are the technologies they need to learn, what are the scams that going on, they actually be prepared, and live nourish, okay? So these are the things that we are also focused into having a healthy diet, how it help them, to build their body mass, their muscles, to help them to stay active and fit. And we also have a senior-friendly exercises machine and in a fitness corners. So we have within our, in Singapore we have a lot of housing development. It's a public housing where it's a lot of flats, right? So near to flats are actually a lot of elderly-friendly exercises machines where the seniors actually can go and do exercises. It's a very senior-friendly, so it's not only for seniors, younger generation also can use, but it's just more senior-friendly so that they feel safer to use it. And we have our healthcare infrastructure and upgrading existing ones. So you could see that, how we are actually trying to support in terms of the healthcare initiative to get them to get active, get early treatment, and manage their chronic diseases early. Okay. Next is the housing and environment, where aging in place. So we always wanting our seniors to age in place. So we know Singapore very small, right? So we don't have enough space to cater to them in a residential care. So we want them to age in place. We want them to be within their family, within their neighborhood, within their social circle. So we are trying to have accessible infrastructure where it's an elderly-friendly transport system, it's a sheltered pathway. This is like one of the picture in a bus interchange where the seniors are having a priority seat to wait for their bus. Okay, so we have things like we have many HDB flats that built in the earlier days. We don't have lift-friendly blocks, so we have a lift upgrading. So to upgrade for them so that every floor have a lift access to the seniors, and we have a sheltered pathway so that when they are going to take a train or they are going to take a bus, they actually sheltered so that they don't get wet. When on the rainy days, they don't fall down, right? The floor can be slippery. So studio apartments. So we have also not only in the the housing board that we have different room flats. We have studio apartments that meant for seniors that they actually can stay in a smaller apartment. And it's supported with the services that within the block to support them in terms of their day-to-day activities. We also got community care apartment, which is a new thing that we introduced. We have about 4 in Singapore now. It's actually involving community care support. It's also involving where they can buy a care package. If they need help in terms of their self-care, they actually can buy a package to have a caregiver to look after them. And they have a social daycare center where they can actually come in together and participate. And they have all the other services like the home help. If they need access to the medical appointment, they have a medical escort service. If they need somebody to send a meal, we arrange somebody to send the meals for them. And also we have we want to integrate the generations, right? So we do provide grants for our families when they're actually buying flat together with their seniors. They have a seniors in the house or they're living near to their parents. The government do give them some subsidies so that they can allow them to buy flat nearer to their parents or grandparents. Elderly friendly homes. So how do we then achieve this? Is actually building up homes with the toilets or the access to the house. Sometimes there are steps to the entrance to the house. The ramps are being installed. We will install a grab bus so that they will be able to be independent, going to toilet and coming out to the toilet, and the floor resisting because when they're using a toilet, sometimes when the floor is too wet, it can cause them to fall. So anti-resistant flooring, they were part of the upgrading work under the HDBs, and of course with the dementia, population are increasing, so we do have a dementia-friendly environment and community. So we are having more communities that are being able to aware what is happening, to a part of their society and know how to help them when they're being lost in the community. Instead of sending them to a nursing home, they're able to support by calling the family and say that, hey, I see your probably your parents or your father here, could you come and fetch? So having the kind of system where we try to support them in the community rather than sending them to a residential care. Next is social integration. So as a social integration, part of it is we have a intergenerational cohesion where you could see from the picture from the young to the old, right? So you can see that kampong for old age, kampong means is a word that we use for, probably familiar in Singapore and Malaysia. It's a neighborhood. We try to keep our neighborhood closer. We have a year-round public education program on active aging. This is to create, our younger population to be aware what are the things happening to their parents, grandparents, so that they know how to take care of them. And as I mentioned earlier, the CPF family housing scheme and the grants, and as well as the tax incentive for children looking after their aged parents. So they will be given some tax rebates when actually they are caring for their aged parents. In terms of the community services, so we support our caregivers, our seniors by many helping hands. So this is one of the things that we believe very strongly, many helping hands, is come from the ground. So as a ground worker, we need to come together to support our senior. It's not just the government, we have to come from the ground, faith-based, and before reaching out to the government to support our population. And it's a home, the services, of course, we got home-based and a center-based services, and as well as the residential care as the last resort. Excuse me. The other area is actually the employment. So we have seniors live longer, right? So we want them to be active and engaged. So we want them to continue to work, right? So we try to help them to raise their skills and their value by introducing a Skill Future Singapore, where it's actually a learning platform where they can actually upgrade their skills. They can continue to engage. Doesn't matter you are 60, you can still continue to upgrade your skills. You can take up some programs to upgrade your skills, so that will allow you to continue to be employed and shape the positive perception towards the older workers. So it helps the employers to continue to hire them, our older workers, and change with the retirement age and the re-employment age. You could see from the picture. So we try to work, our retirement age is used to be, 62. So it's going to be 63, and by the 2030, it's going to be 65. So if you could see that it's an act that, the employer have to follow. But of course, the government also give them some grants and subsidies so that they can actually continue to employ our senior workers. Work for income supplements, is actually allow them to employ and re-employment of the seniors in the employment. Senior employment credit, this is the grants that the government give for our employers so that they can actually allow to continue to employ our senior workers. Yeah. So I just want to also highlight, these are our policies. When we talk about what is the principles behind our policies, actually we are not a welfare state. So I would say that we actually believe in a self-reliance. So assistance is not a welfare, and it's not an entitlement. Okay? Family as a first line of support, and we always believe in a many helping hands approach, and government financial assistance is always the last net, it's a safety net. So if you could see that, one of minister, she talks about how the tackling poverty in Singapore is actually like a kueh lapis. If you're familiar with this, it's like a layer of a dessert with the layers. So you have to peel one by one to be able to achieve, the support that we're going to give them. So this is just to give an overview of the Singapore healthcare system. So we have our primary care, then we have our hospital care, and moving to the community. So what we're trying to achieve is how do we then support our community, right? We want to strengthen the community care so that we are able to help them to sustain in the community longer. So there are a lot of focus on the community services that is put in place for Singapore. So this is our philosophy for Singapore healthcare. So it's always talking about affordability and accessibility, where it's a basic and quality healthcare for all, and subsidies for healthcare services, and this will allow them to be able to accessible to the healthcare infrastructure. And it's an individual responsibility. So it's actually a co-payment by the individuals. So we have different schemes that we use when they actually admitted to hospital or seeking a medical care. They will be using from their own pocket, to pay for their expenses. And risk pool catastrophic illness insurance, which is MediShield Life, and as well as the healthy lifestyle. So this is to keep them healthy so that you don't seek, you don't have a medical condition that you need to seek a medical treatment, right? So it's a preventive and development where we promote healthy living, preventive of health programs. We actually focus more on the health programs, and high standard of living. So we believe in a clean water and hygiene. So you will see that Singapore maintain very good hygiene, and we supply very good clean water. So we actually can drink water in a toilet. The tap water is safe enough to drink. We doesn't need to buy a mineral water. It enables, our market to be more transparency, where as a patient, they're actually allowed to choose where they want to seek their treatment. They will know how much is it cost for me to go for a cataract operation in a private hospital and a public hospital, so that I choose where I do want to get my cataract to be done. So we have, it's a subsidies and a 3M policy in Singapore. So the S stands for subsidies, the 3M stands for MediSave, MediShield Life, and also the MediFund. So if you could see that this is like a tunneling or a pyramid down, where the subsidies is a bigger part of the things that we do to support our seniors and public healthcare institutions. So after that, if it comes from their own pocket, they pay through their MediSave savings for their healthcare expenses, and then we have a health insurance that support larger bills and the healthcare bills. And the last, then where the social worker comes in to support if our needy patients who are not having enough MediSave, and they are not, even after the MediShield Life, they do still have bills that they need to pay cash, and they don't have a means to pay. That's where the social workers will come into the picture. Then we will help our Singaporeans, to support them with a MediFund assistance. So this, earlier I mentioned our Central Provident Fund. So we have 4 accounts that under the CPF. So it was initiated in 1959, and it was ineffective from 55, and effective from 1956. So we have an ordinary account, a special account, MediSave account, and a retirement account. So you could see that every employee, when we started to work, we have a certain percentage of the deduction that goes into our CPF account. So the money will be distributed to all this account, and it actually giving us, at the age when we retire, we have our own house. We actually able to have a save, enough for our medical expenses, and we also have a sustainable retirement plan when we actually retire. And these are the overview of the financial schemes. So there are many financial schemes, okay? So the main things that we are actually covering, looking at the mobility and the consumables assistance, daily activities assistance, the caregiver assistance, because our caregivers are important persons that we look after, so that they're able to keep our seniors at home, so that they allow them to age in place. The medical fee assistance, so these are the things that will be put up or assessed by the social workers, where they are needy and they meet the criteria. We will be able to put them under the safety net to support them. The financial assistance, and of course the other assistance that will be helpful for them. So under the human right approach, the focus area is actually dignity and the autonomy in decision making. The seniors are involved in making a decision where do they care, they wanted to be cared for, and how they want to be cared for. So we have a lot of discussion with our seniors and the caregivers to understand what are the challenges for them to going back home or being cared for at home. What are the needs that they have for them to continue to live in the community. And the protection from the abuse and neglect, where our Family Violence Act, and as well as ensuring our equitable access of the resources. Sorry, they have all the rights to every resources that available in Singapore. The protective legislation in Singapore. So you could see that we have a Mental Capacity Act. This is a framework for the making and the registration of the lasting power attorney. So lasting power attorney, it means that is allowing them to make a decision to decide who are going to act for them when they actually losing their decision making ability, when they probably due to their cognition, it could be due to some of the injury that caused them to not able to make a decision. So they will nominate somebody to be able to decide on them who can act in their best interest. And it also is also provided for the appointment of the deputy by the court, and as well as the establish of the Office of Public Guardian, who oversees, the whole appointment of the lasting power attorney as well as the deputies. We have a Vulnerable Adult Act. So it's empower the state to step in and remove a vulnerable adult who are 18 and above, and we assess that they actually they have a risk to self-neglecting or being, abused by by their caretakers, and where we need to remove them and place them in a safety place after meeting a stringent safeguard. So it also allows us to enhance the punishment for certain penal code offences against a vulnerable adult. So I myself have cases that we need to step in to remove the seniors, to place them in a residential care because they are not able to self-care, or where the care in the community, by the caregiver doesn't able to support them in the community. Maintenance of the Parents Act, so it's enable parents to apply for a tribunal, means it's a monetary support from their adult children. Okay, so it's created by the Office of Commissioner, and we have a family mediation and conciliation is a support, a part of the mandatory of the process. So, but although there's an act, but a lot of times our seniors, may not be willing or very open about it because it's involved bringing, their children to the court, for the conciliation, and they may not be very open about it. So most of the time, this is where the social workers step in. We try to achieve the early intervention. We try to do a lot of mediation work. We try to bring them together to support and to discuss and to see whether could they come together to support their parents or their seniors in the family. If we are able to achieve, that mediation, the outcome, we may not even result in a Maintenance of Parents Act. But there will be some cases that were willing to, and they want to go ahead, they will proceed to apply for the maintenance under the Parents Maintenance Act. So these are the challenges that we will see, by 2030, you could see that Singapore citizens will be 1 in 4 will be 65 and above. So I say earlier, right, 3.5, right, our adult working ratios, the supporting a senior. So it's going to be even shrink. It's going to be 2.7 working adult to support a senior or 65 and above. We have going to have 83,000 seniors who are going to live alone. So quite a number of our population are actually living alone. And living alone doesn't mean that they don't have a family. Sometimes they do have a family, but they prefer to live alone because they are so used to be independent. And we're going to about 100,000 seniors who may have at least mild disability, where they could be requiring at least one assistance for their daily living. So how do we then the future, what are we looking to way forward? We're actually looking into connected, how do we then help them to connect it, to the technology? We try to help them with the smart, accessing to the smart food usage. So we're actually trying to get them to be more familiar. And we wanted more healthier senior, right? We want to healthier life expectancy, right? So we try to work, towards having early detection, early prevention, and keeping them active to be able to remain healthy when they actually age. And these are summaries of the key initiatives that, and the targets. So if we could see that, it's actually achieving active aging, is always what we wanted to achieve. Family support. That is according to our principle. Family is the first line of support. And we want to, have more parks and gardens so that we actually have, the seniors are able to go out, to socialize, to prevent social isolation. Dementia management, because of a number of seniors who are with dementia are also increasing. The transport system, there are things that we are looking for to even improve further. And we are volunteering and learning. So our seniors are also part of our volunteers. We have organizations where they can register to be our volunteers. And so that also another way to keep them active, and contributing to back to the society. And of course, advanced care planning, end-of-life planning, or even pre-planning of the care, where they are lasting power attending earlier, or even doing the advanced care planning earlier, so that they will be able to plan how the care to be delivered when they actually requiring a medical care. So this is just an overview of social workers. What do I do, in my day-to-day work? So I'll be like involving in a casework. When a patient is referred to me, we have to do a holistic care assessment, to be able to understand the family dynamics, the family support system. What is the services in place for the seniors available, and how do we then work together with our family members, our caregivers, the seniors, as well as the community partners to discharge them back to the community. Yeah, so we do a lot of group works as well. We try to support, with the education and the knowledge, share back to the caregivers so that we will be able to support them to be able to take care of their seniors better. The community work, we also involved in providing more community support system where to enhance the psychosocial well-being with the community and the professional development and the education. So we involve the continual learning as well as teaching our future generations to be aware of these are the skills that's important, as well as the program development and implementation. So part of being a ground worker is where you will be able to pick out what are the challenges that our seniors are facing, and it's also a chance for us to be able to escalate or to be able to reach the government. These are the challenges our population have, and how do we then work together to improve the policies that we have, and the research as well as the professional leadership. So these are some of the references. Yeah. So I just want to say thank you. I learned the phrase, but I forgot. ขอบคุณครับ Okay.
Thank you to you too, Ms. Anu. You have taken us to understand the comprehensive situation in Singapore in half an hour. Excellent job. Thank you.
Okay, finally, let us hear from Ms. Suthida Konglermongkol. Suthida holds a master's degree in international social and public policy, specializing in development from London School of Economics and Politics Science, and a Bachelor of Arts from Chulalongkorn University. Currently, she serves as a social development worker at the International Cooperation Subdivision, Ministry of Social Development and Human Security. In her role, she leads programs aimed at fostering bilateral, regional, and international collaborations to promote quality aging and enhance elderly welfare. With extensive experience in international relations and foreign affairs, she has previously worked with the Ministry of Culture and Ministry of Justice, bringing a wealth of expertise to her current position. Kun Suthida, the floor is yours.
Thank you very much. And before I begin, please stand up a little bit. Please stand up. Yes, I think we have like half an hour. All right, have been sitting for an hour, so please stand up and then just relax your muscle. Yeah, I need this. I need this. It is for me actually. Okay, great. Thank you. Now, please have a seat. Right. Yeah. Thank you. Yes, as you have heard, I'm Suthida. I'm from the Department of Older Persons, and it is my absolute honor to be here to present you the national policy on social welfare and human rights for older persons in Thailand. I've heard a lot from Japan and Singapore, and now it's time for Thailand. I feel a lot of pressure today. Yes. Right. Okay, let's start with the first one. So let's see some settings in the demographic situation of Thailand. So Thailand has entered to an aging society since 2005, and now we have already become a complete age society with 13 million older adults, which accounts for 20% of the total population. And we expect that in 2033, we will become a super age society with 28% of its populations are being older adults. And what we mean older persons here are those who are age of 60 years or over, not 65. And the number of dependent older adults also is increasing, and while the number of working age populations, of course, is declining. So yes, the 2021 was the turning point. We have like the numbers of births, the number of days actually outnumber the number of births. So in the long term, Thailand will age faster due to this low birth rate and the low workforce, and the potential support ratio was 2 to 3 in the last 2 years before. And yes, we will have more older persons, and which means we may have like a lot more welfare to provide, and that would affect the administration of the country. And these are just some number from the population, from the children, working age, and older persons. You can see for the children here, we have a declining number, continuously declining, as well as working age, and older persons, in contrast, increasing tremendously. And that's a number. And here we compare with ASEAN plus 3 countries, which are ASEAN members, and Japan, South Korea, and China. Yeah, we are following, I mean, I'm not sure Singapore or Thailand first, but from here we follow Singapore and Japan. You are the winner. Congratulations. Yes, I would. Yeah. Right. So many challenges that we are facing. The first one, increasing share of our aging population, and then climate change is cool, right? But it comes with PM 2.5. And yeah, so vulnerable groups will be affected more in terms of sensitivity, adaptability, exposures, and social capital is declining as well as like filial piety, like family bonds, family responsibilities that will be less. And in Thailand also experiencing a rising social inequality as well. So we have realized this issue. And last year, we had the Ministry of Social Development and Human Security has organized a workshop to gather some ideas from different sectors, like from public sector, private sectors, international organizations, NGO, older persons as well, and civil society to come together and to contribute some ideas, exchange some ideas, and we come up with a 5x5 Let's Turn the Tide policy to address the population's structure crisis. And we have the first 5 is each group, target group, working age, children and youth, older persons, persons with disabilities, and of course we need an ecosystem where it's supportive for the family forming. And the second 5 is the 5 recommendations. And for older persons here, we have we focus more on promoting healthy behavior, preventive care rather than caring when you're already ill, and developing a community-based care for older persons, enhancing economic opportunities, and promoting age-friendly environment. And of course, data is the key. So we try to promote linkage of database for older persons as well. And yes, from that policy, we come with the flagships, with 9 flagships. For example, to enhance the child quality, improving basic infrastructure for older persons, and so on. And we have focus more on disaster management as well, where we provide we are doing a project with the World Bank on the how to create a map for identify risk for climate change and so on. And this will focus more on the flagship number 2, where we improve the basic infrastructure for older persons. We try to expand the implementation of well-being and life protector project. I will talk about this later. Don't be confused yet. And so we also try to monitor. Develop monitoring application for older persons, improving basic infrastructure for older persons, and of course we need to prepare populations before their age, right? So pre-aging preparation is very vital for addressing the aging issues. Yes, we need policy mechanisms here. We realize this aging issues beforehand. I mean, we entered to aging society since 2005, but we had the first plan on 1982. But now we're in we are in phase 3 for National Action Plan for Older Persons. We have 4 sub-action plans to prepare pre-aging populations, enhance older persons' quality of life, and to reform and integrate administrative system, and to enhance the potential of the research for older persons as well. And of course, we need integration. We need to work with a lot of people. We can't work alone. I mean, we have only 200 staff maybe, I'm not sure, but we need to take care of 20% of our populations are older persons. So we need to integrate. We have the integration plan for aging society to integrate areas, volunteer submission. And these are just some partners with the public sectors, like Office of the Prime Minister, Ministry of Public Health, thank you very much, Ministry of Social Development, of course, Ministry of Digital Economy Society, Ministry of Interior, Ministry of Higher Education, Science, Research and Innovation, and National Saving Funds. So these plans, we have 5 key directions to promote the participation in preparation for aging society, and to enhance the vocational skills, promote employment, invite social protection, modify environment and facility for older persons, and of course we need to develop a system and innovation for older persons. And yes, when we have policy, we need law, we need legal mechanism, which is the Act on the Elderly. So this act serve as a legal tool to promote the rights of older persons, to protect their rights and to ensure that they have access to medical care, medical services, education, religion, information, useful information, occupation training, self-development, like social activities, and of course we need to ensure that they have safe facilities, buildings. These are just some examples, and these are more in detail. So a lot of things are enlisted in the Act to ensure, for example, like exemption from the entrance fee or the rights to get the assistance when you are facing with the unlawful exploitation, abuse, for example, or housing. So we use this act as a tool, as a law where we can direct our programs or initiatives. And of course, we need to promote human rights for older persons. I'm just going to discuss with the two organizations here, which is our organization, the Ministry of Social Development and Human Security, Department of Older Persons. So we promote and protect human rights for older persons according to the Act on the Elderly. We promote the right literacies because we believe that in digital era, we need to equip them with some knowledge on the rights literacy as well. And we need to foster a society that older persons can live with dignity and being respected, and promote cooperation as well. And for the Office of the National Human Rights Commission of Thailand, they provide monitoring and reporting human rights violation, policy and law revision, and they promote research, study, and publication. And what we do agree is that we need to promote collaboration between sectors to provide the knowledge on human rights and the protection and promotion of human rights. And these are just some support schemes for older persons that are in our responsibility. The old age allowance, so they will be given some amount of money, but the tier is different. It depends on the age of older persons, and also allowance for family caregivers, social assistance allowance, home improvement for older persons. So these are just some photos before and after. The before is on the top, right? Of course, not. And the bottom is already improved, and vocational funding for older persons as well. And we also provide funeral assistance for traditional practices because we believe that they should die with dignity, respect. But again, with the limited resources, the benefit recipients must meet some requirements and the selection criteria for each scheme. So these are just some examples of government measures. On the first, I will just briefly discuss. So in terms of economy dimension, we provide OH allowance, promoting employment for older persons. On the picture on the right side, they are working with the department store, and also we try to promote the job matching, for example. And in terms of health, of course, we have like universal health coverage scheme. We also have like a training courses for carers, both care managers or caregivers. But in our department, we have like 18 hours for those who want to know more about caregiving for family members. But they will not be a professional carers. You need to take more hours if you want to be paid caregivers. And for society, I love this picture. I use this in every my presentation. So this is a picture from the School of Older Persons. They are older adults who join a school, and I think they love to be young again. They love to wear a uniform. I will talk about this later too. We want to promote the social participation among older persons. So I think we need to create a platform where they can gather and contribute something into society. And environment, of course, we need to provide like kind of environment that are safe for them. So we promote the modification of housing for older persons so that they can live in a safe environment. And this is some steering mechanism. We have policy, we have law, but who we work, who we operate, we have different levels. At the country level, we got the National Commission on Older Persons, and we have sub-commissions as well under this commission. And at an organizational level, we have some ministries who are under the integration plan, policy for aging society, like Ministry of Public Health, Ministry of Interior, Ministry of Labor. And provincial level, we have provincial social development and human security offices across the country in every province. And we also have like a provincial social welfare development centers for older persons, learning and training center on older persons as well. But we believe that to empower older persons, you need to reach them and you need to provide a place where they can reach to. And the most important one is the community level. So we have centers for quality of life development and career promotion for older persons, school for older persons, and senior clubs as our steering mechanism at the community level. And yes, policy dialogues like this is very important too. So at a National Assembly on Older Persons, this is a national level. We have a National Assembly on Older Persons where policy are discussed at the bottom to the top and then the top to the bottom. I mean, it's a process where you gain the ideas, we come up with the final resolution. So the assembly is hosted in every other year. So we got 1 year to do the assembly and then the other year to implement the resolution. And for the second one is a regional policy dialogue. We have like ASEAN +3 regional conference where we can share and exchange ideas. And this is the pictures from the last year. The theme is lifelong learning. So we share, we believe that older persons should have the place where we can get lifelong learning. It's very important for capacity building. And at the international level, we have an international conference and workshops. And last year, we host a workshop with the theme of promoting well-being through the intergenerational solidarity. How much time do I have? Okay. Yeah, so we believe that, we have more older persons in the share of population. We need to ensure that we have social cohesion with different generations. And I think the best way is that you need to promote intergenerational solidarity as well. And yes, partnership and collaboration is the key. And for example, for training and lifelong learning, we have partnership with the APCICT to promote the entrepreneurship for women and older persons. And they will teach about the digital marketing, how to promote your brands, creating stories. For example, we have a cooperate with the university as well for to promote digital literacy, to create the media materials for the older persons. And for employment and job opportunities, I think we need to have a partnership with some private sector as well, like for job matching services and CSR, that project. This is a picture. She is a barista, she's an older person, and she works at the Amazon Cafe. We got one in front of our ministry. Please try. Her matcha latte is really good. I promise you that. And she knows what she's doing. So we have older adult working at a barista, and we also have a contact with the malls to provide some space for selling the product made by older persons. And yes, innovation in aged care is very vital too. Like last year, we have a hackathon to for teenagers, school, university to promote the innovation for aged care. And we have MOU with the National Science and Technology Development Agency to promote aged care innovation. So yes, we can work alone. And this is the project that we talk about too, Wellbeing and Life Protector. It was launched last year. So the objective of this project is to promote paid care system in the community, to provide care for people, older persons in the community. So it's provided by and provided for the people in the community. So they are the people in the community. They are selected by and they are trusted by the people in the community on the principle of community care, social participation, rights and protection, human dignity, social responsibility. So they do not provide care just only physical care, but they provide holistic care because we believe that the older persons must know about social, economic dimension. These are included when they are trained. So selected participants will be trained to be carers, to be a life protector, to provide holistic care, and they will gain some amount of money if they reach the working criteria. For example, working 8 hours a day for 20 days a month, and they will get money. And oh yes, and we plan to promote, like last year we have like 35, but this year we promote to have this project implemented in every province in Thailand. And senior club, so it's also another like association for older persons. It's like gather of older persons for 30 older adults together that they have a common interest. So the operations emphasize activities on health, education, career, environment, religions, art, and culture. It could be anything that they feel that they are interested in. And this is school for older persons. It's like a model, like for promoting lifelong learning, and it's very successful. Right now we have over 3,000 schools across the country. It's a platform where we promote social participation and contribution in the community. You can see the pictures, they are happy to wear uniforms again. So, yeah. And we try to, there will be a curriculum as well, like they need to take a course, like maybe it could be 3 months and you need to study for 4 hours a day, 1 day a week. That's just a sample, but curriculum must be flexible, because if you want to continuity with the older person, you need to be flexible with them, and there will be feedback during the term as well. So curriculum will focus on healthy aging, environment, social security, economic participation, for example. They will learn about technology as well, and this is where we can work with the school, with the teenagers, how to teach older person how to use digital tools. And so yes, I think before I close, I think that when you talk about aging policy, it has to be comprehensive. I mean, aging issue is complex, and it's not just when you are old, but it has to be prepared since you are young, since you are born. And it should cover dimensions like social, economic, health, environment, especially this time of this time that we are facing climate change. And also we need mechanism, we need the infrastructure, we need integration. When you want to work well, you can't work alone. And you need to have like integration at every level. And of course, when the share of older persons in the populations are increasing, capacity building is the key, because in digital era, everything moves very fast. So you need to upskill and reskill them, to equip them with tools so that they cannot be left behind. And community-based older persons associations are the key, where they can provide opportunities for older persons to have a chance to take roles in the society, to contribute to society. And it's a place where you can provide them training, where they can meet, and where we can hear from the voice from them. And then the partnership and collaboration is the final key, that because we can't work alone, and I'm really happy to see you all here, because aging is not an issue for older persons, it's an issue for all, and it affects us all one way or another. And so it's need the collaboration from public, private sector, NGO to ensure sustainability in providing welfare and quality aging for older persons. And that's it. Thank you. ขอบคุณค่ะ
Thank you very much, Kun Suthida. And I can assure all of you that elders, they love putting the school uniform. Yeah,
right.
I encountered once. Oh, they enjoy it a lot.
They dance way better than me. They can move a lot. I mean, I feel old when I was there. They dance like they are really flexible with their body, unbelievably.
Right, and my mom loves that too.
Oh, really?
Yes. Okay, back to you, Doctor.
It's okay. So, thank you to all our speakers for your informative presentations. Now we proceed to the Q&A sessions.
Q&A, right? So we have about 5 minutes to open the floor for questions. So please go ahead. And for the Thai audience, yeah, you can speak in Thai. We have interpreter. And
Hello, my name is Siripat Mangnoi. I'm a medical social worker at Metta Pracharak Wat Rai King Hospital. So I just would love to share, in our hospital, we have medical clinic for the elderly. So under working by Dr. Natapon. So yeah, Dr. Natapon is right there. Yeah. So the elderly people at our hospital, they are so active, aging. Yeah, they're so active, and they always gathering, do many activities. Yeah. And for example, like you said, like dancing or Buddhist things or for special days. Yeah. So I would love to share about activity with Miss Anu later. Thank you so much.
Okay, thank you. So the floor is still open for more questions. Please go ahead. No question? Shall we? Or shall we go ahead? Anything you would like to add? Yes, please.
I have myself question to Ms. Anu from Singapore. You said for well-being of elderly, family is the front line, and then but there are sometimes dilemma, like younger generations want to fulfill their wish, like work or whatever, and then but also they have to take care of elderly. So if you say government says, I mean, family is the front line, is there any way very much effective to make it happen? Thank you.
I would say that, when we are young, we already teach about filial piety. So it's something that very strong in us, from our childhood that, we are taught to look after our parents and grandparents. And yes, its work is one of the important factor. And that's where Singapore actually believe in a many helping hand. We are just wanting to depend on the caregiver to look after our seniors. It's not going to be possible. And we have many caregivers who will be burnt out. And that's where we have our community services, the home-based, center-based, services to support them, to enable them to support their caregivers, to support their seniors, their loved one in their home. And I will say many of my patients, going back home with their caregivers and supported by the caregivers. And when they come to us as a social worker, we always work with them.
So that's all for today. Okay.
That's it.
Okay. Have a
4 o'clock.
Thank you for our speakers and our audience, for your participants till now. Okay.
Okay, thank you very much, all the participants, and we hope that together we can move it forward and make the world better for our elders. Thank you for joining us today. Thank you very much. Bye bye.
Thank you.
สวัสดีค่ะ
Thank
Have
you very
a
much.
wonderful evening.
Yes, thank you very much for the insightful session. And tomorrow I would like to inform you that we have the game booth, yes, for you to get the reward and have a lucky draw in closing session. And please enjoy. Wonderful evening. Bye bye.
Because I'm not from healthcare. Oh.